ready? We're ready.
Hold on.
What?
The Committee on Insurance and Financial Services shall come to order. Mr. Clerk, would you please call the roll to establish a quorum?
Chair Carter.
Present.
Representatives McFall. Here. Breen. Rogers.
Here.
Scott.
Present.
Young.
Here.
Fitzgerald.
Here.
Grant.
Here.
Suriglu.
Here.
Song.
Here.
Harris.
Here.
Markkinen.
Here.
Bazat.
Here.
Aragona.
Here.
Bruck.
Present.
Mayor.
Here.
Smith.
Present.
Madam Chair, you have 16 members present in the forum.
Thank you. We need a motion to adopt the minutes of May 16, 2024 as printed. Rep. Cernaglue moves to adopt the minutes as printed. Hearing no objections, the minutes are adopted as printed. First up on the agenda is a vote on House Bill 4015, introduced by Rep. Conlon and for which we heard testimony February 7th. Since then, the sponsor and her office has been working on with a number of stakeholders on a substitute for the bill. Before everyone is a final product, a substitute identified as H4, which is offered by Representative Grant. Thank you, Representative Grant, for your substitute. Here to explain the sub is Alex Cisak, who is the Legislative Director for Representative Conlon. Mr. Cisak, please come forward. The floor is yours.
Good morning, Madam Chair, members of the committee. My name is Alex Cisak, and I'm Rep. Conlon's Legislative Director. I'm here to speak today to the H4 substitute being offered to House Bill 4015. First, I'd like to note that we will now be capping the copay on insulin at $35 instead of $50. The purpose of this is to achieve alignment with Medicare. We've also made some changes by inserting the language selected insulin products and when available. In our conversations with the insurers and health plans, we recognize that the former change would allow them to ensure that patients had access to at least one of each type of insulin available on the market with a $35 cap. We also clarified what constitutes a selected insulin product, be it rapid acting, long acting, etc. The latter change, when available, was added because products can be removed from the market or end up in short supply. Should a manufacturer ever choose to discontinue its availability, or in the event of a shortage, when available would cover those scenarios. Lastly, we have changed the effective date to December 31st of 2025 to ensure that there is enough lead-up time for insurers to prepare for the cap. Thank you for allowing me to speak to the H4 sub.
Representative Rogers.
Thank you. Thank you for testifying today. Is there any kind of comparison with other states that have already done this or the federal, and then what kind of fiscal impact that has?
Yeah, so I would say that Minnesota is one of the states that has primarily been exploring this and instituted an insulin copay cap. I believe I can get back to you as well on a more fiscal determination of what's to be anticipated within our state.
Thank you.
Thank you.
Are there any additional questions? Rep. Song.
Thank you, Madam Chair. My question is regarding the legislation with the cap. Will that ensure that premiums will not rise and that there won't be a shift?
One of the arguments with respect to an insulin cap is that premiums could, in fact, rise in some capacity. But we found that the science has shown, especially from a medical perspective, that adherence to easily accessible insulin with low copay caps ensures adherence to the medication, through that initial easy access to it, and provides better health outcomes overall. So it can, in fact, lower overall healthcare costs throughout the system as a result of that copay cap.
Thank you.
Members, any additional questions? Rep. Brock.
Thank you for being here in your testimony. As I was reading through it, is there any adjustments that can be made for inflation or as prices rise? I mean, in 10 years, obviously, we're going to be in a different place for a $35 cap.
Yeah, that's a great question, actually. Essentially aligning it with Medicare was one of our priorities currently. And it's something that we haven't explored thus far with respect to inflation, but we would definitely be amenable to exploring that in the future and seeing, if there's an opportunity there as well.
Okay, thank you.
Thank you. Hearing no more questions, let me read in the cards. Not wishing to speak and oppose the bill, Amanda Fisher of NFBIB. Not wishing to speak, opposes the bill, is Leah Robinson, Michigan Chamber. Not wishing to speak and supports the bill, Joseph Sullivan, Department of Insurance and Financial Services. Not wishing to speak, supports the bill, Melissa Seifert of AARP. Not wishing to speak, supporting the bill, is Elizabeth Cutter of the Michigan Health and Hospital Association. Not wishing to speak, supports the bill, Danielle Siriani, National Kidney Foundation of Michigan. Not wishing to speak, support the bill, American Diabetes Association. Now let's move forward with the substitute that I mentioned to adopt, H4, to House Bill 4015. Representative Grant moves to adopt the substitute. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Cerniglu,
Yes.
Song,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Hazat,
Pass.
Arizona,
Pass.
Bruck,
Nay.
Mayor,
Pass.
Smith.
Yes.
Madam Chair, you have 9 yeas, 1 nay, 6 pass.
Thank you. The substitute is adopted. Now we need a motion to report House Bill 4015 as substitute H4 with recommendations. Once again, Rep. Grant moves. Mr. Clerk, can you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Cerniglu,
Yes.
Song,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Hazat,
Pass.
Aragona,
Pass.
Bruck,
Nay.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 9 yeas, 1 nay, 6 pass.
Thank you. House Bill 4015 as substitute H4 is reported with recommendation. Next on the agenda are votes for House Bills 5354 through 5367, the motor vehicle package, which was introduced by Representatives Skaggs, Martis, Brixey, Morgan, Morris, McDonald, and McKinney. We heard testimony on the package on May 16. There's no cards to read in. We need a motion to report House Bill 5354 with recommendation. Representative Vice Chair McFall moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Cerniglu,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Hazat,
No.
Aragona,
No.
Bruck,
No.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5354 is reported with recommendation. Next, we need a motion to report House Bill 5355 with recommendation. Representative Fitzgerald moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5355 is reported with recommendation. Next, we need a motion to report House Bill 5356 with recommendation. Rep. Sonderglue moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5356 is reported with recommendation. Next, we need a motion to report House Bill 5357 with recommendation. Rep. Grant moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5357 with recommendation. Next, we need a motion to report House Bill 5358 with recommendation. Rep. Sonderglue moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5358 is reported with recommendation. Next, we need a motion to report House Bill 5359 with recommendation. Rep. Young moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5359 is reported with recommendation. Next, we need a motion to report House Bill 5360 with recommendation. Rep. Scott moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5360 is reported with recommendation. Next, we need a motion to report House Bill 5361 with recommendation. I think Rep. Rogers is moving. Rep. Rogers moved to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
are being taken away. Donald Trump says that he's proud.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Brock,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5361 is reported with recommendation. Next, we need a motion to report House Bill 5362 with recommendation. Rep. Fitzgerald moves to report. Mr. Clerk, will you please call the roll?
Chair Carter,
Yes.
Representative McFall,
Yes.
Green, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglue,
Yes.
Song,
Yes.
Harris,
No.
Markkinen,
No.
Kazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5362 is reported with recommendation. Next, we need a motion to report House Bill 5363 with recommendation. Do we have a motion? Rep Zong? Okay. Rep Zong moves to report. Mr. Clerk, will you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Serniglu,
Yes.
Song,
Yes.
Harris,
No.
Markinen,
No.
Bazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5363 is reported with recommendation. Next, we need a motion to report House Bill 5364 with recommendation. That Rep Grant? Yeah. Rep Grant moves to report. Mr. Clerk, will you call the roll, please?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Serniglu,
Yes.
Song,
Yes.
Harris,
No.
Markinen,
No.
Bazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5364 is reported with recommendation. Next, we need a motion to report House Bill 5365 with recommendation. Rep Serniglu. That's Rep Young. I saw it now. Rep Young moves to report. Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Serniglu,
Yes.
Song,
Yes.
Harris,
No.
Markinen,
No.
Bazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5365 is reported with recommendation. Next, we need a motion to report House Bill 5366 with recommendation. Rep Scott moves to report. Mr. Clerk, will you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Serniglu,
Yes.
Song,
Yes.
Harris,
No.
Markinen,
No.
Bazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5366 is reported with recommendation. Last but not least, we need a motion to report House Bill 5367 with recommendation. Rep Scott again. I see you. She moves to report. Yes, Rep Scott. Oh, Mr. Clerk, would you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Breen, Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Serniglu,
Yes.
Song,
Yes.
Harris,
No. No.
Markinen,
No.
Bazat,
No.
Aragona,
No.
Bruck,
Nay.
Nair,
Pass.
Smith.
No.
Madam Chair, you have 9 yeas, 6 nays, 1 pass.
Thank you. House Bill 5367 is reported with recommendation. Last on the agenda is a vote for House Bill 5694, which I introduced and we heard testimony on May 16th. Since then, my team and I have been working with a number of stakeholders on a substitute for the bill. Before everyone is the final product, a substitute identified as H1, which was offered by Majority Vice Chair McFall. Thank you, Majority Vice Chair McFall, for offering the substitute. Joining us here virtually is to explain the sub is Michael Stern of Chubb Insurance. Mr. Stern, if you are there with us, please unmute your mic. The floor is yours.
Thank you. Good morning, Madam Chair, Vice Chair McFall, Vice Chair Harris, and committee members. Thank you so much for allowing me to appear before you again. I am Michael Stern, Chubb's Insurance's Midwest Vice President of State Government and Industry Affairs. I've been asked to explain the H1 version of House Bill 5694. When the original version was posted, a number of parties voiced concerns. After speaking with these parties, as well as working with Chair Carter and policy staff, we believe the version you have before you this morning addresses the concerns expressed. Specifically, H1 still allows insurance carriers, producers, and others to provide insurance-related value-added items and services. However, the amendments would do the following: exempt health insurance companies and plans from the bill, add additional products subject to the new law, such as supplemental insurance and long-term care insurance, leave in place agent dollar maximums for giving customers items not related to value-added services, and to tie the rulemaking process to Michigan administrative law. Chubb believes the H1 version of House Bill 5694 is still a very positive step to allow insurance value-added services and items to be offered and delivered in a smooth and efficient manner. I'd be pleased to answer, to the best of my ability, questions you may have regarding amended House Bill 5694. Thank you so much.
Thank you, Mr. Stern, for explaining the substitute. Do any members have questions? Okay, hearing none. Now let's move forward with the substitute. I need a motion to adopt the substitute H1 to House Bill 56, and I flipped the page too fast, 94. Majority McFall moves. Mr. Clerk, will you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Green,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant, Sonderglu,
Yes.
Song,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat,
Pass.
Aragona,
Pass.
Bruck,
Pass.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 10 yeas, 0 nays, 7 pass.
Thank you. The substitute is adopted. Now we need a motion to report House Bill 5694 as substitute H1 with recommendations. Once again, Majority Vice Chair Mike McFall moves. Mr. Clerk, will you please call the roll?
Chair Carter,
Yes.
Representatives McFall,
Yes.
Green,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Sonderglu,
Yes.
Song,
Yes.
Harris,
Pass.
Markkinen,
Pass.
Bazat,
Pass.
Aragona,
Pass.
Bruck,
Pass.
Nair,
Pass.
Smith.
Pass.
Madam Chair, you have 10 yeas, 0 nays, 7 pass.
Thank you. House Bill 5694 as substitute H1 is reported with recommendation. I'm seeing no absent members from the committee, so we need a motion to adjourn. Who moved? Rogers. Representative Rogers moves to adjourn. Hearing no objections, this committee meeting is over.